So let me ask you something. What if your body tries to warn you that a stroke is coming and you missed it? Not because you are not paying attention, but because nobody ever told you what to look for. Every single year, nearly 800,000 people in the United States alone suffer a stroke. Up to 80% of strokes are preventable. That means most of the people who lost their ability to speak, walk, or even recognize their own family didn't have to. So today I am going to break this down, and by the time this video ends, you will know exactly what your body is trying to tell you before a stroke happens. Before we talk about the warning sign, I want you to understand what a stroke actually is. Because once you get this, everything else will click. Think of your brain as the most expensive city on earth. Every street, every building, every power line is running 24/7. Now imagine someone suddenly cut off the water supply to that part of their city. Within minutes, the buildings start collapsing, street go dark, and the longer that water is cut off, the more of the city is destroyed permanently, and that's a stroke. So your brain needs a constant, uninterrupted supply of blood to survive. The moment that supply of blood is blocked, either by a blood clot, which we call an ischemic stroke, which is the most common type, accounting for about 87% of all stroke, or by burst blood vessels, which we call a hemorrhagic stroke, brain cells begin to die, not in days, not in hours, but in minutes. Time lost is brain lost. So here are the warning signs. Number one, a sudden weakness or numbness on one side. This is the one people most commonly ignore. You are sitting at a dinner and suddenly your right arm feels strange, not painful, just disconnected, like it doesn't belong to you. Or one side of your face feels like it fell asleep at the dentist, except you haven't been to the dentist. Why one side? Because each hemisphere of your brain controls the opposite side of your body. So when a stroke hits the left side of your brain, the right side of your body is affected, and vice versa. So that one-sided numbness is your brain screaming for help. So don't wait, don't sleep it off. So number two is the sudden confusion or trouble speaking. Imagine trying to say, I need a glass of water, and what comes out are scrambled words in the wrong order, slurred, or nothing at all. Or you are listening to someone speak and their words sound like a foreign language you've never heard before. This is called aphasia and is one of the most terrifying stroke symptoms because the person experiencing it often doesn't realize something is wrong. They think you are the one who is not making sense. If someone around you suddenly can't string a sentence together or seem confused in a way that came out of nowhere, take it seriously. Then number three is a sudden vision problems. This is not about needing glasses. This is sudden one eye or both eye going dim, blurry, or completely dark. Some people describe it as a curtain being pulled across their vision. Others sees double. So the what happens here is that the visual cortex sits at the back of your brain. When a stroke hits that region or disrupt blood flow to the arteries feeding it, your vision pay the price. Then number four is a sudden severe headache with no cause. Not your regular tension headaches after a long day. I'm talking about what the neurologists call a thunderclap headache. A pain so sudden and so intense that patients often describe it as the worst headache of their life. This is a hallmark warning sign of a hemorrhagic stroke where the blood vessels in the brain has burst. If anyone uses those exact words, worst headache of my life, get them to the emergency room immediately. Then number five is dizziness, loss of balance, or trouble walking. Suddenly feeling like the floor is moving, stumbling for no reason, feeling like you are on a boat in a rough water when the part of the brain that manage coordination or balance is affected. Your body simply stop cooperating. Then number six is a warning sign most people don't know about. We call it a mini stroke, which is TIA. Here's what neither most sources fully emphasize, and I want to make sure you hear this clearly. Before many full strokes, the body sends a trial run warning. We call it a transient ischemic attack, ATI or TIA. People call it a mini stroke. It produces all the same symptoms, weakness, confusion, vision problems, but they pass. Some in minutes, some within 24 hours. And because it goes away, most people breathe a sign of relief and do nothing about it. This is one of the most dangerous decisions a person can make. Research published in the New England Journal of Medicine found that the risk of a full stroke within 48 hours of a TIA is as high as 10%. Think about that. 1 in 10 people who had a mini stroke and ignore it will have a full stroke within 2 days. And a TIA is not a false alarm, it's a final warning. Here's the first method, which is your emergency checklist. When you suspect a stroke in yourself or someone, don't try to diagnose it. Use this. First is the F, which is the face. Ask them to smile. Does one side of their face droop? Do you see fewer teeth on one side? Then the A, which stands for arm, ask them to raise both arms and hold them up for 10 seconds. Does one drift downward? Then S is for speech. Ask them to repeat a simple phrase. Is it slurred? Is it strange? Or impossible to understand? Then T is for time. If any of these signs are present, call 911 immediately. Don't drive yourself. Don't wait to see if it gets better. Here is why speed matters so much. The the clot busting medicine used to treat ischemic stroke called TPA has a treatment window of just 3 to 4 hours and half hours from the moment the symptoms begin. And after that window closes, it can no longer be safely used. So every minute of delay is the brain tissue that cannot be recovered. A 2023 study published by the German neurologist found that sleep disordered breathing, particularly obstructive sleep apnea, significantly increases stroke risk, yet it remains massively underdiagnosed. Patients with untreated sleep apnea have up to 3 times the risk of stroke compared to those without it. Why? Because every time you stop breathing at night, your blood oxygen drops, your blood pressure spikes, and your heart rhythm is disrupted, all of which are direct contributors to stroke. So here is the takeaway. If you or your partner snore loudly, wakes up gasping, or feel exhausted despite full night's sleep, please speak to your doctor about a sleep study. This is a modifiable risk factor that most people never connect to stroke. And before I continue, if this kind of content helping you to understand your health in a way that actually makes sense, go ahead and hit that subscribe button right now. I post videos every week breaking down complex medical topics into real practical knowledge you can actually use. You don't need a medical degree to understand your own body. That's exactly why I am here. And there is a way you can prevent all this. So number one thing you can do is to control your blood pressure seriously. High blood pressure is the single biggest risk factor for stroke. And the frustrating part is that most people with high blood pressure feels completely fine. Get it checked. If it's high, work with your doctor on the lifestyle changes and where necessary and medications. Then number two is that you need to quit smoking. And this includes secondhand smoking. Smoking double your risk of stroke. It damages blood vessels. It promotes clot formation and accelerates the narrowing of arteries. And yes, secondhand smoke counts. If someone in your home smokes, the risk goes up too. And number three, move your body. You see, regular exercise, even brisk walking for 30 minutes, 5 days a week, reduces stroke risk by improving blood pressure, weight, and cholesterol levels all at once. So you don't need a gym, you need consistency. Then number four, you need to know your numbers. Cholesterol, blood sugar, blood pressure, these three numbers kept in healthy ranges dramatically reduces your stroke risk. So schedule a checkup, don't guess. Then number five is that you need to limit alcohol intake. Heavy alcohol use raises blood pressure and can trigger irregular heart rhythms, both stroke risk factors. Moderation is key. The number six, if you are on a hormonal contraceptive or HRT, have a conversation. Birth control pills, certain hormones replacement therapies, and steroids can increase clotting risk. If you have other risk factors like smoking, hypertension, family history, discuss this with your doctor. Stroke doesn't always arrive with dramatic warnings. Sometimes it whispers. A numb hand, a moment of confusion, a headache, unlike any other mini stroke that passes and gets forgotten. Your job is to listen. Now you know what to look for, what to do, and how to significantly reduce your risk. Share this video with someone you care about because this is the kind of information that belongs in every home. I am Dr. Emmanuel. Stay informed, stay healthy, and I will see you in the next video. Thank you.